As coronavirus cases in India cross the 3 lakh figure mark, as India records the highest single-day jump of 11,458 fresh cases, and as India has become the fourth worst hit nation globally, Prime Minister Modi met with his ministers and officials to review the government's response to the spiralling crisis. Now, in view of the challenges being faced, particularly by large cities, what and how can we do to be prepared for what is to come? How can we stay best informed of the facts? Well, to help you out, we have tonight Dr Randeep Guleria, the Director of the All India Institute of Medical Sciences, an advisor to the government, member of the constituted high-level committee constituted by the LG this week to suggest effective steps to deal with the COVID-19 outbreak in the capital. Dr Guleria, thank you so much for your time. We know you are an extremely busy man, but thank you again. So, Dr. Guleria, India's COVID-19 cases have jumped from 2 to 3 lakhs in 10 days, as we've recorded our worst daily spike of over 11,000 cases. This even as testing levels are going down. So let's focus on Delhi first. You're going to be present in that emergency meeting scheduled for tomorrow with the Home Minister, the Health Minister, the LG, the Delhi Chief Minister. This comes even as a day after the Supreme Court told the Delhi government to explain why its COVID testing has dipped from 7,000 to 5,000. The Delhi government is now pointing fingers at the centre. In this blame game, they are saying the ICMR needs to change its guidelines. Is that true?
So first of all, I think we need to increase testing, as you rightly said. And even if you go by what the ICMR guidelines have said, still the number of people tested needs to be much more in the hotspots. The guidelines clearly say that if you have a close contact, anyone who's positive, the close contact should be tested. There should be tracing of these cases done. And also those who are coming to the hospital with ILI and SARI, that should be done. I think we need to really ramp up testing, especially in hotspots, because they will help us in guiding our treatment strategy and our management strategy and the containment strategy. At the same time, we need to see what is the bottleneck. Is it related to these patients not being able to reach the lab? Are we having different criteria? Is it the cost, and how do we get the private sector on board as far as the testing is concerned? But I think there is definitely a need in these cities where the cases are increasing to ramp up testing and to see how we can reach out and test people, even if it means going out to the community rather than waiting for them to come to us.
And according to our reporters on the ground, that seems to be the same feedback that was put across to the Prime Minister in the meeting today with his ministers and his officials. Dr. Guleria, the Delhi Chief Minister, meanwhile, has said that numbers may grow to 500,000 by the end of July. Now, testing levels in several states have gone down during periods when the positivity rate, of course, for our viewers' benefit, let's say that that's the proportion of the tests that yield a positive result. That is increasing. That's the opposite of what you would expect, right? That states ramp up testing and positivity rate decreases. Is that worrying?
It is a cause of worry. As a matter of fact, if we look at our positivity rate, that is number of tests done and number that turn out to be positive, for many weeks it had been stable at around 4 to 5%. But over the last few weeks, 2 to 3 weeks especially, it has really increased, and despite the increase in number of testing, the positivity rate has gone up, and that is a cause of concern. That means there is an increase in number of cases, and that is why we need to be more aggressive in these areas where the positivity rate is high, both in terms of testing, in terms of contact tracing, in terms of quarantine, isolation and containment, because it obviously means that there is an increasing number of cases happening there. It's not related only to the increasing number of testing that we're doing.
So what does this mean then for community transmission? Because there's been so much controversy about this, the government maintaining that no, we're not in it. Like you're saying, this is worrying. The positivity rate rising is worrying. Delhi's added COVID cases twice as fast as Mumbai. Are we entering community transmission?
So again, it's how you look at it. And I think community transmission is some sort of a phrase which has sort of been hammered around a lot. If you look at the data from the entire country, and that means data from the zero surveillance also, we are definitely not in community transmission as far as the country is concerned, because there are large areas of our country where the cases are not going up or they're actually coming down, and there is definitely no community transmission happening there. However, if you look at these hotspots where the cases are increasing, where we're finding that especially in the containment zones, the numbers are increasing very dramatically, as you're seeing in major cities, it's very likely that a local community transmission is happening there. And that is why the cases are increasing here. And we therefore need to have a different or a differential strategy when it comes to managing these areas, because here, what is the issues? The issues here are that you have a huge number of people collected in one area. The population density here is very high. And when you have a very high population density, if you are not able to aggressively promote facilities like isolation and quarantine, there will be a spread in the community, because if you have 5 people living in the same house and they're going to different places for work, or they're sharing the same toilet, then you will obviously have a spread which will happen in that community, and that will actually lead to increasing number of cases. So a strategy of how do we isolate these people away from this area where there is overcrowding needs to be looked at.
And similarly, the same feedback was given to the Prime Minister in that meeting this evening, with that 2/3 of cases are in 5 states. So keeping that in mind, Dr. Guleria, Prime Minister Modi will be meeting with states on the 16th and 17th. And there's been, I'm sure you've seen this, received this. Many people have asked you about this. All these rumors doing the rounds that given the cases and how they're rising, we should be expecting another lockdown. Beijing, parts of Beijing today were locked down due to a fresh virus cluster in the US. Health officials are warning that states may need to reimpose strict restrictions if COVID-19 cases spike. Where do you stand on this? Do you think, given the cases and the rise and the inability of our infrastructure in many major cities to keep up, that we need another lockdown like we saw?
So again, our strategy has to be differential. Like I said, that there are areas, and if you look at the data also, actually, there are just less than a dozen cities which account for more than 80 to 90% of our cases. So we need to see if we need to have a strategy which may include a limited lockdown in these areas, then will that work, and can we do that for areas where the cases are rising, and then have a strategy that if we do that, how do we then move ahead in making sure that the lockdown is effective, the cases are decreased, and a conclusive strategy can be put in place so that this area then effectively is able to decrease the number of cases. So it has to be a strategy. Lockdown can be one strategy among many that one can consider. But again, like I said, we have to focus and do a lot of micro planning, both in terms of decreasing the number of cases, having a strategy for the health resources in these areas, and seeing how we can have a management strategy in case there is a surge in number of cases.
Okay, so you're saying micro-planning needed, lockdown hotspots, cities if needed, but not the entire nation. India does not cannot afford another all-India lockdown, you're saying. Okay, so Dr. Guleria, there have been so many issues that have come up even today, so I want to quickly get through all of these on the show for our viewers. First and foremost, I think what everybody is very interested in is the fact that the Health Ministry has issued this new clinical feature of COVID-19, right? They're saying loss of smell and taste are new symptoms of the virus, something that we should watch out for as we try and protect ourselves from catching this virus.
Yes, so I agree with that. This was something which the CDC had put up a few weeks ago, and at that point in time we were not sure whether this would be something which would be commonly seen in our population, because this is something which is very specific. But we've had cases that have come. I distinctly remember one lady who came a few weeks ago. She flew in from outside. She came in one of the flights which had been started. And the first thing that she noticed a few days later was a loss of the smell. She couldn't smell the perfume that she was using. And subsequently, she was a loss of taste. And because of that, she had no other symptoms. We got her tested and she turned out to be positive. So as we learn more and more about the virus and we see how it's behaving, we are finding some new symptoms which may give us a clue that this may be something which could be related to COVID infection. And that is why that gets sort of added on into the list of the symptoms that we have. We started off by saying that this could be just a simple upper respiratory problem and viral pneumonia. Now we know that it causes systemic effects. It can lead to a lot of clotting occurring in different parts of the body. We know that it can have a systemic effect, which we did not know a few months ago. So we are learning as far as how this virus is, because it's a novel and a new virus. So there is new things which will continue to be added, whether it be the symptoms, whether it be the treatment strategy, or whether it be how this virus will evolve over the next few months.
And Dr. Guleria, you mentioned how we need to figure out a way to rope in or bring in the private sector to work amicably. Maharashtra has today announced the regulation of charges for COVID treatment in private hospitals. Where do you stand on this? Because in Delhi, for example, we haven't seen this yet. And we're hearing of numerous complaints across the country of overcharging, allegedly, by private hospitals, and a significant proportion of COVID hit persons get treated in the private sector. So where do you stand on this?
So I think this is a pandemic and there has to be a partnership between the public and the private sector. But everyone should come forward and say that because in this time of need, we need to do whatever we can rather than looking at profit margins. Also, I think we must understand that we are a country where patients will look for beds if they are sick, and they will want to try even the private sector or the government sector. But if we have a huge charge in the private sector, these patients will therefore not be able to go there and thereby cause problems in terms of being told that there are no beds available, where in fact there may be a number of beds which are available. So a balance has to be struck, because I also agree with the fact that in private hospitals, they have to be able to have some degree of earnings so as to sustain themselves. So that need has to be met, but it should not go on to a stage of greed. And that is what we need to do in terms of balancing how the private sector can come on board with a reasonable charge, which will look after their needs. But it doesn't really need to lead to a situation where patients are denied treatment because it's just beyond their paying capacity.
Okay. And the other big controversy, of course, today is that WHO experts backtracking after saying that asymptomatic transmission is very rare. So they retracted that statement. Is that worrying for us specifically in India? Because we've not witnessed the peak. You've told us that you think it's at least 2 months away possibly of the infection. And a big percentage of those who constitute the illness in India are asymptomatic.
Correct. So I think there has been a lot of controversy regarding the asymptomatic and the pre-symptomatic in terms of the numbers. And I remember that the initial papers which came out almost 3 months ago actually were actually criticized by people that saying that it's unlikely that there is asymptomatic spread, and they looked at how influenza behaves and said this is how this virus should behave in this manner. But as more and more data accumulated, we came to know that there are asymptomatic individuals or who have very minor symptoms and don't really realize that they had COVID-19. And therefore, I think this is a significant number. You can debate, and maybe subsequently when we do a serosurveillance, we will come to know how big this number is. But it could vary from about 25 to 30% to as high as almost 50%. It's a cause of concern because it means that there are individuals who will not know that they have COVID infection and they can be infectious. And it's not going to be possible to test all of them because of the fact that this is an evolving disease. You may be negative today when we've tested you. Tomorrow or day after tomorrow, you may become positive and still be asymptomatic and be spreading the disease. So in my mind, the strategy has to be preventive. And in cities like Delhi, where you have a large number of cases, I would say that the best strategy is presume everyone is positive unless proved otherwise. So therefore, your whole protective strategy, when you go out in terms of wearing a mask, in terms of hand washing, in terms of maintaining social distancing, becomes so important. I have seen people who go to office and will still sit together and have lunch or have the tea together, take off their mask and then talk to each other. You don't know among those close friends of yours or office friends, one of them may be an asymptomatic carrier and be spreading the disease. And you may get the disease and you may not have a problem, but it's possible that when you go home, you give it to someone else, the elderly in the family, and he gets a very severe illness. So when we are having a situation like this, it becomes all the more important that all of us have these strategies in place, whether it's in office, whether it's going to the shopping area, or whether we're just going to do our day-to-day work or traveling. Just have the strategy that possibly the person sitting next to you may be positive and maybe an asymptomatic carrier who's spreading the infection. Unless we do this, we will not be able to stop the spread of infection. And that unfortunately is not happening. As the lockdown is coming, as we're coming out of the lockdown,
Yeah.
Many people seem to have forgotten these strategies, and you see a lot of people walking around even without wearing a mask.
Being much more complacent right now, unfortunately. Doctor, the other controversy, of course, Professor Steve Hanke, he's a professor of economics at the University of Johns Hopkins. They listed India as a bad apple. That's a quote for alleged underreporting of coronavirus cases. The same Professor Hanke in March had predicted that the coronavirus situation in India was spiraling into chaos. And of course, Johns Hopkins has been leading from the front with a global tracker for coronavirus that's used by media organizations the world over. So it's extremely credible. So what would your response be to this?
So I think there are 2 or 3 things that we need to keep in mind. One is the population density that we have, the number of population that India has is you could have a large number of countries in Europe you could combine, and that would form the population of India. I mean, some states have more population than some countries in Europe. And our challenges are different. We have constraint as far as the health infrastructure is concerned, and therefore we have to find our own solutions. In terms of testing, our testing has been ramped up from when we started about 10 to 20,000 tests a day to now almost 1.5 lakh tests a day. There's still a lot to do, I do agree, because considering the size of our population, we need to continue to ramp up our testing. But I also agree that we need to develop strategies when we say that we are testing to answer specific issues. Just random testing in our entire population is not going to be useful. If we were to say at one point in time, we test 5% of our population, that turns out to be something like 7 crores. And this is an evolving disease. Testing today doesn't mean that you can't get the infection tomorrow. So we have to have a concrete strategy. But I also think that besides testing, individual responsibility, the social responsibility becomes huge in terms of being able to take measures to prevent the spread of infection. Somehow we haven't been able to get that message across, and people don't seem to understand their responsibility in fighting this pandemic. This pandemic is going to be fought by people in the households, in the streets, and at home rather than in hospitals.
Oh, it's always a good reminder to constantly, spread that and repeat that, Doctor. We're almost out of time, so let me ask you one question that I'm sure you feel like you've answered so many times, but now in a new set of protocols, the Health Ministry has removed its earlier recommendation of using hydroxychloroquine in combination with azithromycin, right, in several cases. Now, again, a change to the public, I'm sure, is completely confused about what they should do. What's the final stand on this?
So hydroxychloroquine has unfortunately been into a lot of controversies, and that is why there has been data against and for it, and based on that the guidelines will change. It's important to remember that these are guidelines which are evolving. These guidelines may further change in the next 10, 15 or 20 days, depending on how the data emerges. We did not have drugs like remdesivir were not in the initial guidelines. They were subsequently added as emergency use authorization. Hydroxychloroquine still is there as far as mild cases is concerned, or we are still recommending it as prophylaxis. But when it comes to more sick cases, the data suggested that combination of the 2 drugs may cause more side effects, especially cardiac side effects. And since this was raised as a concern in many recent articles, it was felt that if you have to give an antibiotic, you could give something else which will not cause increase the chance of cardiac side effects if both hydroxychloroquine and that antibiotic are combined together. So that is the philosophy behind this. But like I said, things will change depending upon what the data shows, and it's possible that you may have strong data in favor of hydroxychloroquine few weeks down the lane, and you may reintroduce it in the treatment strategy. So I think this is something which is evolved. We're still learning, as I said, about this virus, and that implies even for the treatment strategy.
All right, talking about being few weeks down the line, last question to you, Dr. Guleria, tonight. You said that we're going to be having to fight this more in our homes and through our personal behavior. But is there light at the end of this tunnel? Is there anywhere close by? What should we, the viewers, all of us, be looking forward to? How long will this be expected to continue? Because, you know, today the news, of course, the big international headline has been that parts of Beijing were put under lockdown again due to fresh coronavirus cases. A new cluster, Beijing's first case in 2 months after somebody visited a meat market. They had no international travel outside. So it's a dismal note to end on. But does this mean that this could reoccur?
So it does mean it could reoccur. That's why a lot of people talk of what we call the second wave or subsequent waves, because if we are able to contain the virus and prevent its spread, and that will happen over a period of time, both in terms of the fact that a large number will get infected and there will be some herd immunity. And if you have some immunity, you then are not able to spread the infection to others, and therefore that chain gets broken. But at the same time, there is always a chance that the virus may remain in some individuals. And if we don't follow our precautions that we have been saying for the last few minutes, it will again lead to a cluster development. And this has been shown even in history. If you go back to even the 1918 pandemic, it came in multiple waves. And actually, the reason for these waves were because people let their guard down. Once they felt that the peak was over, it was coming down, they felt now everything is okay. They started having parties, going along, meeting everyone without the restriction, and this led to a resurgence of cases. So I think we need to be careful even when we are across the peak, because you never know when another cluster may develop.
All right, so this is the new normal. The sooner we accept it, the better it will be for everyone concerned. Thank you so much, Dr. Randeep Guleria, for your time again. Thank you, and bye-bye.